Skin donation has been a real game changer, and we are able to save more lives entirely because now we have skin banks in India.
Hi, Dr. Keswani. Very honored to have you on the Scarless Tomorrow podcast. Essentially, let's just jump right into it. Do you have anything you'd like to say before we start?
So I think it's been a pleasure having you with us at National Burn Center for the time that you spent with us, and it was nice to see the passion with which you saw everything and did everything and absorbed everything, did the homework that was assigned to you. And we look forward to a good discussion in the next couple of minutes. Please go ahead.
Yes. So, just as like a introductory little tidbit that I wanted to add, could you share with us what inspired you to specialize in burn care and plastic surgery? Like, what kept you motivated? In this field is very challenging and it's a very emotionally demanding field. So, what kept you motivated and driven to like work in this field?
I guess, Nayantara, every field is challenging, and one should not belittle any field over medicine. Medicine, of course, is a little more demanding than other field, but it is very safe to assume that in every field, unless you're passionate, you can't do a good job of it, and you can't put in as much time and sustain the pressures that each field demands. There is no field which does not demand the passion, the commitment, the hard work. Yes, but medicine involves a little more because, especially plastic and burn surgery, where human lives are at stake. So we look after a tertiary burn care center, the National Burn Center, which is one of the leading centers in India. And India has a very large population of burn patients, and due to various reasons, and looking after them and getting them to survive, and then looking after them to see that they get minimal scars and minimal disability is quite a challenge. And that requires a lot of customized care and treatment, along with providing them a lot of reassurance and psychological support so they go through the whole treatment, which can last as long as 3 to 5 years, many a times. So I think from a very young age, we were very keen on doing, we were very passionate about doing whatever we were doing. I was into sports a lot, and I think once you're into sports, you don't give up. Sportsmen don't give up till the last, the match is not won or lost till the last ball is bowled, kind of a thing. So with that same karenge ya marenge attitude, I have been practicing medicine, and I think it has worked out well both for myself and my patients.
Yep, I definitely do think so too. I think that attitude is very important, whether it comes to any field. Having that
Yes.
sort of positive mindset that what you're going to do, you're going to do it, you're going to try hard, and you're going to do best is
Yes.
most important in today's age. What
Absolutely.
I noticed from what you said is we were talking about how burns treatment is significantly different than usual injuries, let's put it that way. So, could you explain to us like what are the basics that one should know as a person who's at least surrounded by like burns incidents that happen, especially because they're so common in India? What are like the basic first aid things that one could know and follow?
Uh, right. Essentially, all the kind of burns that you get, essentially there are about 4 or 5 categories. One is the flame burns, one is the burns due to hot liquid known as scalds, one are the chemical burns, one are the electrical burns, and lastly are the radiation burns, which fortunately do not happen too often unless in the event of a nuclear holocaust. So all these burns, the primary first aid is cooling down the burn, which is possible by only by pouring water. The colder the better, but don't apply ice because ice can be deleterious to the outcome of the patient, especially in very young children and the elderly. So, pouring water on burns till the burning sensation subsides is the slogan that we have been trying to popularize so that people do this in the event of a burn accident. Pour water till the burning sensation subsides. Yes, if you're on fire, you've got fire, then the dictum is to stop, drop, and roll. You stop wherever you are. If you run around, the flames will get more oxygen. They get exaggerated, and you'll have more flames. So stop wherever you are, drop down and roll. That will smother the fumes because it will knock off the oxygen supply. So stop, drop, and roll, and pour water. That's the two basic first aids that anybody should follow in the event of a burn.
Yeah, and I think it's very important to know this because it's not very popularized by a lot of people, or it's something that a lot of younger children in particular tend to just throw aside, I've noticed, and they don't really remember this in cases of like accidents where, oh, they actually see someone on fire, they themselves are on fire. And I can say that from like personal experience as well. When I got burnt, I don't think it hit my mind that I should stop, drop, and roll, which inadvertently could have reduced the amount of burns that I did end up having. But as I was speaking about that, could you tell me a little bit about how the treatment protocols and the treatment in itself of burns have evolved over the years? Because I hear there's a lot of new scientific developments that are going on behind the scenes about burns and burns treatment protocols. So, could you tell me a little bit about that?
Burns does differ from the usual critical care management in the sense that burns involves all the systems of the body, that is the cardiothoracic system, the respiratory system, the GI system, the central nervous system, the skin, and all the organs get involved. But ultimately, the bacteria which come onto the skin get absorbed into circulation, and that blood circulates all over the body. So there's a dissemination of infection. So you have to be aware that it is a multi-system organ involvement, and it requires essentially a team approach. One plastic surgeon cannot look after burns. He needs a fantastic, dedicated, equally dedicated team of individuals. Especially the base of the pyramid of burn healthcare is formed by the nurses whose job is so demanding. They have to be with the patient all the time, providing the medication, monitoring the heart rate, the blood pressure, the urine output. And if this job is well done, then the role of the clinical psychologist to ensure that the patient maintains the equilibrium while the treatment is going on. It can be very taxing psychologically to be lying in bed with tubes inside the nose, inside your urethra, and an intravenous line in the neck or in the groin. It's not easy. So the psychologist has to come in. The nutritionist has to come and see that you get adequate nutrition, that your healing happens faster. You need to have a chest physician to ensure that your lungs don't get infected. The microbiologist tell you what bacteria are growing so that I can give the appropriate antibiotics so that the bacteria don't win the battle with the patient and cause severe sepsis. The physiotherapist to mobilize your limbs so that you don't land up with a functional deformity and you're absolutely normal and fully functional after you heal up from the burn. So it entirely is a major team approach. Of course, pain management is a very important task. You need an anesthetist who sees to it that you got minimal pain or no pain at all. Of course, there is some element of pain, but it can be taken care of almost completely with a good psychological support and good pain management protocol provided by the anesthesiologist. So, all in all, the team approach is what makes it different from other medical specialties. And you need a very big team because burns can be labor intensive, and a major burn may require as long as 6 to 8 weeks in hospital and another year or two on an outpatient basis to become completely okay physically, mentally, emotionally, and socially.
Yeah. And I know that burns is a very physically scarring accident that takes place. So, when it comes to extensive burns, like burns which are probably more than 50% total burn surface area, what are probably the greatest challenges that you face or the hospital faces treating patients with these significant burns? Like, how do you manage immediate life saving interventions with like the long term goals of functional and aesthetic recovery of that sense?
Right. The major burns are classified into those who are anything below 20% is not considered major. Anything above 20% body surface area is considered major. That's
Yeah.
one thing. So anything above below 20% may not require hospitalization, but anything more than 20% in an adult and less more than 10% in a child would require and necessitate hospitalization. The biggest challenge in the initial phase is to see that the patient gets enough fluids intravenously. That's the most important part. First 48 hours, called the period of resuscitation. And then subsequently, it's the wound management to ensure that the wounds heal up in the minimum period of time. The longer the wounds take to heal, the more chances of scarification. So today in India, we follow the international or global gold standard as regards burn management. That is early excision and grafting. That is, moment the patient gets burned, within the first 2 to 3 days, maximum 5 days, uh, or within 48 hours, the patient coming to you, you get out all the dead tissue, because the dead tissue is what causes the infection. If we keep infection away, the chances of patients surviving are much better. And if you remove the dead tissue earlier, then the chances of uh, wound healing faster and scarification is much less. So survival and scars are both the result of delayed resurfacing or delayed grafting. If you have grafted in time and with adequate skill and knowledge and experience that we are supposed to have, you normally get a fairly good outcome. Patient does survive and has almost near normal skin and 100% fully functional. That's what we aim for. So wound management and initial phase resuscitation are the key factors. Of course, as I mentioned earlier, there's a whole long period of physiotherapy which is required to get if your fingers or hands got burned, functional parts, they have to be moving all the time. So there are gadgets to make you move it. There are exercises which are advised by the physiotherapist. The patient has to be compliant. Patient has to be motivated. Patient should have a good circle, good family backing to be kept motivated, because there are periods where you get depressed and you say, it's taking so long, I'll give up. There's no point in taking so long. And you don't see the results so fast. It takes a very long length of time before you actually see yourself getting better. So there are periods where the patient feels that no, it doesn't seem to be working. Many times they doubt the doctor's treatment. They want to take second opinion, third opinion, fourth opinion, but they always come back. But then they realize, yes. And what I found very useful is when a patient comes out into the outpatient department on an OPD day and speaks to other patients who are undergoing the similar therapy, and when they realize that yes, everybody is taking that much time, and they see some patient in the later stage of treatment and they say that yes, मुझे भी ऐसा हुआ था, I had the similar problem, अभी मैं बिल्कुल ठीक हो गई हूँ, जैसा डॉक्टर बोलते हैं आप करते रहो, do whatever the doctor says and you'll be completely all right. So I think they get a lot of solace from hearing other burn survivors speak, and they tend to trust them more than the doctor. Rightfully so, because a doctor's job is to provide reassurance and support, and sometimes they feel that doctors bluff. Doctors don't really bluff. They are telling you factually, yes, it does take time, and burns does take time. So the difficult part of burns is explaining to the patient and reassuring the patient, yes, the scars will go, they will take time. So I think having faith in the doctor, having faith in yourself, and having faith in God are three faiths which are very, very important, burn, because the treatment is protracted and long.
That is true. The treatment is very long, but I think also having that sort of environment around you is also very crucial, especially when it comes to either very young children who do make up a large percentage of burn cases in India. It is very important to have that sort of support from your parents, have that sort of support from your friends. And I think the support is not only contained to the hospital, but also after you become an outpatient, when you go back and you try to reintegrate yourself into society, because burns is physically scarring. And for a lot of people who may not be fortunate enough, the scars are in visible areas, or they do hamper their daily routine. So you have like a burns in your
Skin donation has been a real game changer, and we are able to save more lives entirely because now we have skin banks in India.
Yeah, and having spent time at the skin bank, actually, I think I can corroborate your statement that it is honestly a very interesting development in the scientific field, especially in medicine and in burns care. I think it's completely revolutionized the way that we approach burns in itself. And I feel like in a few years, there could even be an introduction of xenografting, although it does seem like a distant possibility. At one point, allografting itself was a distant possibility. And I think with this sort of development, it's really pushing us about 10 years in the future and sort of giving us this holistic view of how burns could be completely revolutionized as a field. I actually wanted to ask you, when it comes to burns, there's also often a lot of plastic surgery that's involved, post corrective surgery. after the burns have fully healed. And during that time, what do you think are some of the ethical challenges that patients or doctors have to face when it comes to that similar debate between function versus aesthetic appeal?
So, as far as these challenges post healing, what we call as post burn reconstruction, there are basically two post burn sequelae which require to be addressed. One is the contracture, that is the deformity across the joint. People have fingers which are bent like that, the elbow is bent like that. Sometimes the shoulder is stuck by the side, known as axillary contracture. Sometimes the chin is stuck to the neck like that, or it goes like that. Mouth remains open. It depends on where the burn was, and if the patient had not received good primary treatment or comes from the village where primary treatment is not existent for burns, or people are not knowledgeable about good primary treatment for burns, they'll end up with these deformities. With these deformities, they can barely function. Now imagine somebody's hand is like that. How is he supposed to eat, or how is he supposed to go do and do his potty, and how is he supposed to go for work and things like that? Would anybody accept somebody whose hand is like that and mouth is like that and thing mouth is open like that? I think there's a good psychological problem and a functional problem. So both these, once the deformities are corrected, and all these deformities are fully correctable, except the skin color and texture does leave a little wanting, but almost near normal skin color and texture does come, and the functionality 100%. So, but it does take a while, and the surgeries are expensive. But luckily, we have projects like Operation Restore, again with the Rotary, where we get funding from Rotary to do these surgeries free. Our team, our hospital, National Burn Center, offers the treatment completely free. We don't charge the patient, and the patients come repeatedly. Some require multiple stages, 4, 5, 6 stages also. Every 3 months, we call them and do these surgeries in camps, 20, 30 surgeries at one time, in 3 days' time or 2 days' time. We call a group of like-minded plastic surgeons and anesthesiologists who offer their services completely free of cost. And our own physiotherapy team looks after their functionality. So once the deformities are corrected, they need to go fairly long and intensive physiotherapy to retain the function and the functionality and get the tendons moving again. So it is a very demanding thing, and it is also there's some element of discomfort and pain. It's not easy to mobilize things which have not moved for 2 or 3 years. But the patients, once we motivate them, once we show them results of other patients who benefited, once they see the light at the end of the tunnel and they see some hope, they are motivated. They do follow all the protocols that we explain to them: how to move the hand, what exercises to do, how to do muscle strengthening, what all movements they are supposed to do. And periodically they come to the hospital and under supervision of the physiotherapist, get assessed and then told newer exercises to do. We are able to achieve our goals of 100% functionality, even the worst of burn deformities and contractures.
So, I would ask you, is it always a clear cut answer to the debate of form versus function, or it's case specific or something like that?
No, no, there is no debate on that. See, when it comes to form versus function, it's always function over form, because unless you're functional, you cannot talk about form. So, though if it can go pari passu, you can correct form and function together, nothing like it. But if there's a choice, if we have to exercise an option between form and function, first we correct the function, and then later on, over a period of time, there are various methodologies by which corrective cosmetic surgeries can be done. Today, there are various forms of lasers like fractional CO2 laser, Q-switched Nd:YAG laser, IPL laser. We have all the lasers at the National Burn Center, which help the patient's scars settle down, almost to bring the patient back to near normal, as much near normal as is possible. So patients are really happy, and these laser sessions are done once a month, and each patient may require about 8 to 10 sessions, and over a period of 2 to 3 years, the patient does come back to normal.
So that's an interesting outlook on that, because I would also say function over form is probably the most important thing. From like a clinical aspect, what would be some of the biggest lessons that you've like learned from working with burns patients?
Uh, Nayantara, I think The biggest thing is India can ill afford to treat burn patients. They're very expensive to treat. The facilities are still not enough considering the patient load that we have, a burn patient. The focus should be on prevention of burns. Almost half of the burn patients which come, half of these burns are preventable. And children have to be taught in schools right at a very young age how to prevent these burns, how to prevent burns in the kitchen, how to prevent burns in the industry, how to prevent burns when you're at work doing science experiments with chemicals in laboratories, and what is the best first aid. So we, on behalf of the Burns Association of India, of which I happen to be the secretary, we have been doing burn prevention programs in schools. We have a team of about 6 to 8 people who go to schools and give talks. And if you remember, you had gone yourself and given talks with them to school children. And if you catch them, young children are like sponges, and they absorb all the information that you give them. And the talk is not more than 15 minutes. So you basically want them to remember a few things. What is the best first aid? How to prevent burns? What to do? What is the first action? Suppose you're in a smoke-filled room following a burn accident, or then you have to put a wet handkerchief on your nose and crawl on all fours, not stand up, because carbon particles tend to rise up when they're heated. So there are more carbon particles in the top layers of the room than in the bottom. So you have to crawl on the floor with a wet towel or a wet hanky on your nose and mouth so that the carbon doesn't go into your respiratory tract. So simple things like these, and we have found that it makes a lot. So the focus, now this is happening only in Bombay. So such prevention programs and prevention awareness programs on burn prevention and first aid and about skin donation have to be held all over the country, and more people must do these programs, because prevention is the key to reducing the number of burn patients in India. And as I mentioned to you, half of the burn accidents are preventable. Even in industry, we many of us go and give talks in industry to the safety officer, or we hold seminars for safety officers of big companies which are dealing with electricity or petrol or diesel or inflammable materials or chemical factories, and they come to us, or their medical officer. We guide them what to go and teach their workers. So I think it's very important that we go do on an ongoing basis this awareness program, because people tend to forget. Workers have to be hammered in and repeatedly told that नहीं ऐसा करना चाहिए, ये गमबूट पहनना चाहिए, goggles पहनना चाहिए, you're dealing with chemicals, gloves पहनना चाहिए. So they should follow all these precautions, and this can prevent a lot of morbidity and mortality. So I think prevention is what you need to focus on. And two, having more and more skin banks and more good burn centers, so that they don't have to be too many, but there should be one in each part of India, north, south, east, west, central, so that one apex center and few satellite centers which give good care, so that you can do a triage. Say somebody can go to a primary burn center, a secondary burn center if the burn is more, and a tertiary burn center for if the burn is really big and you require all specialities. So let's say less than 20% burns the primary center, 20 to 40% secondary center, and above 40% should go to the tertiary center like ours, so that unnecessarily the big centers are not crowded with small burns. Small burns to be treated by smaller hospitals, little bigger by intermediate hospitals, and the hospitals with the best facilities like ours at National Burn Center. We are a 50-bedded burn care facility, only the very severe burns, so that we can focus on them and our attention doesn't get distracted by the smaller burns. So I think the government is looking into it. They are much more receptive than what they were earlier. And today, organ transplants have also increased in India, and there are bodies like the National Organ and Tissue Transplantation Organization called NOTO. And in each state, there is what is called SOTO, that is State Organ and Tissue Transplantation Organization. So they are helping organ donation in general. And the skin donation is part of this whole organ donation program. So we are getting many more skin donations now than we ever got in the year 2009 since we started. And we get almost 20 donations a month now, which amounts to about 240 donations a year, which is quite a lot.
I think rightly so. There are a lot of things that I can say myself I did not know before I actually came to the hospital and I learned about things. And these are barely like minute, small things that could basically make a difference in how you end up treating yourself, or like even for minor burns, how your burn ends up healing. Like just simple things like don't use turmeric on your burns, or don't put toothpaste. All of those things like that are simple things that people tend to neglect or not look at, or even simply forget about or mislearn because of traditions that have been followed in houses. And I think it's like these little things
Yeah,
that will
maybe they
actually,
didn't know at all. Maybe they didn't know at all. Yeah.
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 And I think it's these small things that will actually make the biggest difference when it comes to, and I hope not, but like a burn incident that happens with them, perhaps. Thank you so much, sir. Just to conclude, is there any form of like important message that you would like to convey to our listeners, whether they are patients, families, or healthcare professionals, about the field of burns and the importance of resilience and recovery?
Right. The only thing I would like to say is that whenever you see a burn patient who's badly scarred, don't shun them, offer them job opportunities just because they're not looking okay. I mean, this is just a quirk of an accident, and then they're suddenly shunned by society. People don't give them jobs, and they think they're useless. They're not useless. Till they got burned, they were absolutely functional and okay, and then suddenly, just because you're a little scarred, doesn't make him non-functional. Again, when the bus or in the train, if some scarred burn patient sits next to you, don't think he's an untouchable or an outcast. Don't try to go away from him. Engage him in conversation. Treat him on par with the normal individuals. I think the burn patients must be treated with a little bit of respect and dignity. And an accident is what befell him or her, and that's why they're looking what they were. They were not born ugly, but they become scarred, and many of these scars will go away. But if we start shunning them, then it adds to a little bit of a psychological problems also, and which are very difficult to correct. And these people do not have access to psychological care also. So on an ongoing basis, if you see a burn patient, give as much sympathy, empathy that you can. Try to help them out in case they are financially not okay. And if you are a little better off than others, give of yourself, as they say. Khalil Gibran had said, it's only when you give of yourself that you truly give. Giving of your possessions is not a great thing. So I think spend time with these people. If you get a chance, visit a burn hospital. If you get a chance, donate to the cause of burns in terms of providing treatment to people who are underprivileged. I think keep a very sensitive mind when you deal with burns, because everyone is not as privileged to have access to good and ideal burn care, and everybody may not be educated enough to know where to go and how to go there. Though we are offering free treatment, we have found it very difficult to get patients from poor sections of the society or economically challenged sections of society, because they think private hospital there the charges will be very high. But we have in private hospitals sections which are concessional or free. We get special funds from Rotary and other like-minded philanthropic individuals to give us funds. So I think creating awareness for burn prevention, first aid, and if each of all of us can become ambassadors for creating awareness for skin donation, creating awareness for burn prevention and first aid, I think it'll do a lot for preventing burn accidents in the future. Thank you so much, Nayantar.
Thank you, sir. Thank you so much for being on this podcast. I think it's truly been insightful, especially to hear it from the doctor himself. And I think I've learned a lot. I think I'm sure our listeners are going to learn a lot more about this elusive world of burn care. And I think that would be it. Thank you so much.
Thank you.